Hello, I'm Elizabeth Makous, the Pelvic Whisperer. As a physical therapist who has had the honor and privilege of treating the pelvic floors of men and women for over 25 years, I am always on a quest to find better and easier ways to release tight muscles and fascia. And on my quest, I discovered some really cool ways to use the pelvic therapy TheraWands. So on our journey today, I hope that you will also sort of figure out which TheraWand is the best for your body's needs. Another surprise use for the trigger wand, and all the wands actually, is for my cancer patients. As a certified lymphedema therapist, I spend a lot of my time releasing scar tissue from surgeries and from radiation, especially in my tongue and throat cancer patients and my breast cancer patients. In these patients, what happens is they get a lot of scar tissue either under their arm and on their chest that make it difficult to raise their arm and to move their neck, and especially in throat cancer patients. So how I have them use the trigger wand is, and I do a lot of this laying down, but they can also just hook into that radiation and that surgical scar tissue like this, into their chest, along their throat and necks. All of this is a great tool for a home program to release all that. The vaginal one and the pocket one can also be great for my cancer patients. So the V1 can certainly get under here in the axilla and along the breast, and the pocket one is really particularly great for the throat and the neck in here, the axillary region, and along the jawline. So I might choose those in some cases, but if the patient has a lot of posterior scapular problems and upper neck trap region problems, then I'll have them get the trigger wand, because that's the only way to really get that. All right, I think you get the idea. These wands are useful tools for your body when used wisely. So be creative, but please be careful. And even better, get your pelvic floor physical therapist involved. Let them teach you and show you how to be safe. All right, well, be blessed and happy releasing.